Good morning. It's nice to see virtually all of you again. I'm Heather Drake, MPHA's Membership and Engagement Director. I'd like to welcome you back to our 2022 conference. Thanks for being here. In this 90-minute session, we have 3 different presentations, all on public health communications and messaging. So I'm excited to introduce our first speaker. Haley Privat is a Research and Evaluation Coordinator with Portland Public Health, and she's here to talk to us this morning about a picture is worth 1,000 data points, using data visualization to improve the understanding of data and to tell critical public health stories. As she's presenting, please remember you can interact using the chat and enter questions using the Q&A feature. So I will turn it to you, Haley. Thanks for being here.
Thank you so much, Heather, and thank you all for being here today. I really appreciate you all taking the time to join this block and join in on my presentation. And I know I have quite a few folks that are following this presentation. And so I'm excited to see, I'm in good company, and I'm excited to see their presentations coming forward too. So we'll jump in. Today in 30 minutes, we're going to cover quite a few fundamental concepts of data visualization. And really the hope that I have today is that it entices you a little bit to think about what data you might have and what data you might have access to right now that you can reignite or re-examine through different visualizations. We're going to cover kind of, the overarching what and the why. Why do we visualize our data? When to use certain data visualizations and how to get access to those, and then where to find some. I hope to leave you with some tangible resources today to support you in doing so. So we can just jump right in. I have no disclosures. Anything I talk about today, it's more so just because I'm a fan of certain software or certain, different products, but no disclosures. So what is data visualization? Really, it is the practice of translating information into visual content that to really make data easier to understand. And when I say easier to understand, that understanding means that we're able to take kind of all these rows and these columns and identify different patterns, identify trends, identify outliers. And that's what I mean by understanding our data. It's not just getting a bunch of rows and columns and saying, okay, great, we're done, check that box. It's taking a look at what's in those rows and columns and really building that out to kind of say, okay, well, this is going to give us a little bit more insight on what we're seeing here. Data visualization, I wanted to talk about a couple of the pros and some of the benefits of visualizing our data. It really allows us to easily share our information, provides quick and effective ways to communicate information in a universal language. And I say that because data visualization, oftentimes they follow typical conventions that help us so that we, when we're looking at a visualization, we oftentimes understand that maybe darker areas or larger areas are more densely populated, or, there are certain conventions that data visualization follows, and we'll talk about those a little bit in some of the principles. But it's really important that some of these universal standards in data visualization are followed, and that's a big principle that we'll talk about in a little bit. Data visualization also allows us to visualize patterns and relationships. Like I said earlier, you're not going to get a ton of insight from a bunch of columns and rows, but you might get a sense of, what is our overall sample? What is our overall, what are we asking, or what is this data attempting to provide us? But the story's not there. And so visualizing patterns and relationships allows us to understand, again, those trends, those outliers, those patterns that really allow us to then create some opportunity around seeing or to identify some opportunities. So these visualizations themselves are opportunities for us to look at our performance and maybe give us some indication on where we can make some decisions around maybe infusing some additional funding or resources or staff, different assets. They allow, visualizing our data allows us to kind of take a look at maybe what's missing, and where we can fill in some of those blanks. Data visualization really helps to make some of this data more memorable for either some of our stakeholders who our audiences are. I know I strive to really try to make visualizations appealing so that my audience, who are typically staff at the health department, kind of say, okay, this is really highlighting to us a need, or highlighting to us an area that we could possibly infuse some other resources into. Try to make it memorable. Now, of course, because I talk about pros and I talk about the benefits, of course, there are caveats and there are disadvantages sometimes to data visualization. Sometimes in our attempt to distill information, in our attempt to really, kind of peel out a lot of the noise and distraction of what a data set might be and what we might get from a data set, sometimes some of those core messages can get lost in that translation of taking these rows and columns and putting them into some type of visualization. And so we want to be really careful when we're doing this. For example, if you're viewing a visualization with so many different data points, it's easy to make an inaccurate assumption. And so as the person who's doing these data visualizations, you have to be really careful about what we're doing, and making sure that we're telling the full story. If done incorrectly, data visualizations can be biased or confusing, and it's not intuitive on always how to do it. And so sometimes visualizations are designed wrong. And even the best data visualizers out there, some of the bigger names in the game, make these mistakes. And so it's really important to have some really solid principles that you follow. And we've kind of developed them a little bit at the health department too, to support us in making sure that when we're putting out visualizations and when we're putting out when we're talking about data, that we follow some conventional wisdom around what these might look like, because we understand that sometimes they can be misleading and they can be confusing, and that's not our intention at all. So I do want to go over a couple of basic principles, because I think at the very foundation, when we're creating any type of visualization, whether it's a very simple graph or a chart or a table or something a little bit more involved like an infographic with multiple data points, we have to remember a couple of things to kind of keep us grounded, keep us coming back to what we're trying to do and how we're trying to achieve this. Because really the goal of this is insight. It's not the goal of visualization is to get insight. It's not just to put a picture out there. It's to be able to kind of take some of that information away. So I want to go over a couple of principles that are really important when you're doing this. Knowing your audience. If you are to Google anything out there about data visualization and creating anything from a data set, you're going to find that knowing your audience is first and foremost the principle that you really need to kind of set yourself in. And it really helps to also kind of set, what are we looking at in terms of accessibility and other types of things that maybe we need to consider when we're trying to put together this visualization. Knowing who we're going to present this to, knowing who we're trying to convey this information to. More often than not, you're creating these data visualizations to communicate to a specific audience. And the whole point of creating the visualization is lost if the message really isn't conveyed. And so showing what you want, showing what you have in a way that your audience can access it and can understand it is really important. A good data visualization should really resonate with the audience. And so, maybe doing certain visualizations according to job roles, or taking into consideration education and expertise of the audience. This is where, knowing your audience and being sensitive to ethnicity and cultural values is really important. and focusing on literacy of the audience. We don't want to go too in depth around specific statistics and terms when that's not the audience that we might be discussing or talking with. And so we want to make sure that our data visualization fits and is communicative to that audience. And part of that is also choosing the right chart. There's a lot of information out there on the internet, and so I won't go too much in there, but there's a lot of resources out there that are supportive around choosing the right chart for the type of information that you're trying to convey. Choosing the graph based on the kind of data and the message is really important, because some excuse me, some charts, some graphs are typically better suited for certain purposes. Line graphs, for instance, are typically better when we want than a bar graph to show a comparison over time. But a pie chart might be more useful for showing, parts of a whole, but not when we're trying to focus on certain segments of a population. So it's really important, to really think about some of the data that you have and the data that you have and how you want to show it, because there are some really there's some conventions out there that you really should stick to when you're trying to present some of your data. Two other points that I really want to highlight are emphasizing the important facts. A data visualization can really encode so many different data points. And so highlighting the most important facts to convey the message faster and with more impact can be done with, just certain colors and sizing and patterns to emphasize different data points or show a focus area. This isn't to say that you're cherry picking information and you're cherry picking data to highlight. It's just meaning that you're highlighting certain areas that you want the message to be conveyed. Cherry picking is a big thing, but it's important. The purpose of these data visualizations is insights. It's not pictures. And so, we're cherry picking is, that's when you are picking certain data points to, if we have a whole set and we only want to talk about a certain, demographic or certain responses as part of a whole. We don't want to cherry pick. We want to make sure that we're sharing the information as much as possible. And again, that purpose of data visualization is insight, it's not pictures. And so an intuitive design is more important than a bunch of appealing charts and graphs. And so if you don't need the graph, if you don't need the chart, and you just have a number, just give the number. There's a lot of discussion out there about when and where to use charts, and some of the resources that I leave you all with today will support you in making those decisions. And then the last principle I want to touch on is, and it sounds pretty obvious, but being skeptical about your data or even the data that you see as a data visualization. It sounds obvious, but it needs to be said. There's a plethora of graphs and information that may misguide the reader by showcasing skewed data and projecting false narratives. And it's our job of the presenter to really inform the audience of what data we have available to us. And so avoiding certain methods, omitting the baseline, kind of going against some of these conventions, cherry picking data, going against bucking some of these conventions can really lead to some of that misleading information, and we don't want to do that. And so when you're doing these visualizations, ask yourself questions about what data is not represented in that visualization. Do we need to provide another visualization? Does this not work in this context? Is the story not there? And it's important that we take consideration around what we're showing, and kind of recognize that oftentimes they can be used to mislead or misguide, and that's not our intention. So we want to be really, really careful about data visualization. There's, again, we're just scratching the surface today in hopes of enticing some other and enticing you to kind of go check out either your own data or maybe take a look at some of the examples that I will show that you're probably pretty familiar with. But there's a lot of different families, different categories, different subcategories of data viz out there. And I'm just going to kind of scratch the surface of four major ones, but even these have subcategories and things and specific considerations you might want to take into account. But we will just kind of breeze through charts, geospatial, data viz, infographics, and dashboards. So a chart is really an umbrella term. A chart is a representation of data in the form of a graph, diagram, map, tabular format. I think, as we explore some data visualizations, I really wanted to highlight something just probably you're all familiar with, the Maine Shared Community Health Needs Assessment. These are really great examples of tables and charts, and throughout that report, I know they spent a lot of time on, really looking at the accessibility of those charts and those tables, really trying to understand their audience, picking charts really, really carefully to show distribution, to show comparisons. So a lot of those principles that we just went through, I know that there were many people involved to make sure that that report reflected a lot of those principles of data visualization. And so it's a really great example of how to visualize data to a broad audience, although it is a technical document, but just a one that I really wanted to highlight. There are over 40 different types of charts and graphs. I mean, bar, line, area, pie charts, pictographs, columns. I mean, it goes on and on and on. And so there are, like I said, a bunch of resources that literally help you kind of choose between which chart so that you can show your data in the best way possible, because some charts and some graphs are better suited to some data. And it's important to know that. Geospatial is another visualization that shows data in map form using different shapes and colors to show the relationship between different pieces of data. And I like to show this example because it really serves a really strong purpose, and it's public restrooms in the city of Portland. And there was a need really that was highlighted in the pandemic, that we really needed to have a sense of where our public restrooms were, where did people have access to running water, where were bathrooms that just had hand sanitizer and things like that. And so the city of Portland's Public Works Department put together this map, and really behind this map is just a bunch of columns and rows of locations, street name, bathroom location, facilities that are available. And those rows and columns really wouldn't show us very much. This way we can at least see a map, know where we are on, in relation to that map, in relation to the nearest restroom. And it kind of, allows us to see data in a different way. It's not so different from one of the OG data visualizers for my public health nerds out there, and John Snow and the Broad Street Pump. Data visualization has been around for centuries, and it's allowing us to make decisions and highlight things that we so that we can identify problems, identify areas of success, and this is always one of my favorite ones. And I want to touch on infographics. This is a little snippet of an infographic from the Health of Portland report that the City of Portland's Public Health Division put out a few years ago. And I hesitated kind of highlighting it because the data itself is a few years old as we work right now to update that. But something that we really paid attention a lot to, and why we liked the infographic style of data visualization, is that we could do a lot with it in terms of accessibility. when we wanted to translate the document with all of this data, an infographic was a cheaper way to do it, to be quite frank, because there's a lot less narrative in it, because there's a lot less, just words and less to translate. It was more cost effective, and we think it was a stronger document because there weren't as many differences between translated documents. My husband's also colorblind, and so I've learned this pretty quickly early on, when he literally doesn't see the same colors I do. And so we wanted to make sure that so that bottom one you see is actually how my husband sees things. It's called deuter anomaly, and it's red-green colorblind. It's the most common colorblind. And you'll see that the colors are just different, but everything is still legible, everything is still readable, and that's really important. It's a really important part of access and data visualization. The last one that I want to highlight is that I'm sure many of you saw, and really is such a strong example of data visualization, is our COVID-19 dashboard, and the way and the way the state has packaged things in Tableau to really be able to visualize things, not only comparing different different outcomes, or comparing our different timelines, but it allows us to really kind of dive deeper into our vaccination statuses of our communities, and they've really done a very good job of knowing their different audiences and choosing the right charts, and really trying to highlight and emphasize the important facts, so that when us as readers kind of jump on and see this plethora of information, we follow it very easily. And so I really wanted to highlight some of these really amazing things across the state of Maine that we see all the time, in hopes that maybe it would inspire you all to also take a look at what you have available to you. Lastly, I just want to kind of throw out a couple different places to get started. And a lot of what you've seen today can be done in a lot of our in-house software. So are you a Microsoft Excel person? Are you a Google Slides Sheets person? A lot of, Google, the Google Suite Enterprise has a lot of capability, and I understand Excel does too. And they're always growing a lot of those fields in terms of, even what their artificial intelligence might suggest. I know Google does a lot of that, suggestions around how you can visualize your data. So there's a lot of just, that might be available to you all. Canva is a really powerful tool, and it's available for free to nonprofits and to educators and government. There's quite a few that they offer different free accounts, and so I would take advantage of that if you haven't already. It's a really great, powerful tool. The Evergreen Data is a really awesome blog if you're kind of nerdy and you want to get into more about the back end of some of the accessibility behind data visualization, and there's just a lot of good reading if you have some time and you're interested. That chart chooser, excuse me, is so important. I use it pretty often just to kind of confirm some of the things that I'm like, okay, I'm heading in the right direction when I visualize my data this way. Or, oh, actually, I never even thought about doing this graph or a type of chart. But that actually tells my story a little bit better. So I'm going to go with that. So these chart choosers are really great to kind of just get your brain thinking about different opportunities. And then YouTube. If you haven't spent time on YouTube, Googling and looking for tutorials, I can send you a list. But I would say that, most of the questions that you might have, somebody else has had too. And so it's okay to go to places like YouTube or that Evergreen Data and take a look, and email me too. I'm always like to ask questions and to have a conversation. I wanted to leave you all with this last one, because I think it's a really timely reminder also of this time of year. And so it's kind of a retrospective look at moose crashes in Maine. And I it's a friendly reminder that this time of year we always see spikes in moose crashes. And so kind of just, public health reminder of being safe out there on the roads. But you can see that the way they've really shown this data is in multiple different visualizations to really show that we have some hot spots across the state. We also have some time of the year that we tend to see more crashes than others. So a good data visualization, you can kind of get that context really quickly. And I think this one does it. And it's very timely and very appropriate for us here in Maine. Lastly, please get in touch if you have any questions. And I know we have probably have just a few minutes for questions. Of course, I overspoke. But please email, call anytime. I'm a big data nerd and I would love to just talk to you about what you have and how you can kind of gain some insights from it. So if there are any questions, I'd be happy to take some. If not, thank you all so much for being here and thank you for your time.
Thank you, Haley. That was so helpful. And I know I have personally reached out to you several times with questions, especially with how to use Canva, and you've been super helpful. So thank you. And you did answer one of the questions that came up, which is about different tools for doing data visualization and how to learn to use them. So we'll skip over that one.
Okay.
And the other question references, you mentioned your husband's color blindness. So as we think about equity in access to data and in using data visualization, are there tools or resources that folks can use, such as, what colors to avoid or font sizes to use? I've read you shouldn't use all caps, things like that.
Yeah, there definitely are tools out there that I can also send Heather to you or send some resources. I'm trying to think of a couple off the bat. I actually have an extension in my Chrome browser. It's called Colorblindly. And basically what it does is it changes my screen and whatever I'm creating. So if it's a presentation or a flyer, it changes my screen color so I can see how people with color blindness might see my flyer. And so that really shows me, maybe where I've had two colors that are layered on top of each other that they can't distinguish. Some things that are really important specifically with that are high contrasting things. And so even if you have, light yellow on top of dark blue, that contrast is enough that you should be able to see that even with some colorblind, even if you have colorblind. And so there's a lot around culturally and linguistic appropriate data visualizations. And so I'll share some information. They're kind of align with our class services. So or class standards, excuse me. And really trying to encourage really clean, really simple data visualization so that you're kind of taking into consideration some of those cultural values. You're not always going to get it right. And so I think being open-minded to trying and exploring and getting it wrong and being open-minded to hearing that you got it wrong too. I definitely, I've heard that with my husband, that's for sure. But I've also heard that, in that you might be focusing on one thing and you don't always get it right. And so I think just you trying to make it and a lot of these tools like Canva are built so that the color palette itself maybe is highly contrasted, or the color palette itself isn't green and red so that they all bleed together. So helpful tools like that.
Great, thank you. And we've had several other questions pop up, but unfortunately we are at time. But I would encourage you to please reach out to Haley using her email, or you can message her too within the conference platform. And we can also send these questions to you too, Haley, if you want to follow up in an alert or other way to folks. So thank you so much. Again, we are going to take a brief 1-minute-ish break while we transition to our next presentation, which is on who controls the narrative. So we will see you back here in about 1 minute. Thanks, everybody. Hello again, everyone. Thank you for rejoining us if you're just coming in or staying in the session to continue the conversations on public health messaging and communications. So our next presentation is Who Controls the Narrative and Whose Narrative Is It to Control? And we're joined by Michelle Mitchell, Executive Director, and Michelle Munsey, Program Evaluator Manager, both with Partnerships for Health, and Sarah Lewis, Director, and Maine Ibrahim, Program Assistant, both with the Maine Access Immigrant Network. So thank you all so much for being here. We're excited to learn from you, so I'll let you take it away.
Thank you, Heather. And thank you to everybody who is joining us today. As Heather said, my name is Michelle Mitchell. On behalf of Partnerships for Health and Maine Access Immigrant Network, I wanted to thank you for joining us as we share our narrative. None of the presenters have any personal commercial interest to disclose, and we do want to acknowledge the great work of Gretchen Buzel and Walter Fisher and encourage you to learn more about their work. Humans make sense of the world through stories, and Walter Fisher theorized that we reason through these stories. He differentiated between the narrative and the rational paradigm. At the core, these paradigms differ in terms of how we experience and understand the world. The narrative paradigm sees humans as storytellers that communicate with each other and make decisions based on good reasons. These reasons are determined by factors such as history, culture, and worldview. In contrast, the rational paradigm sees humans as rational beings who make decisions based on arguments. These arguments adhere to specific criteria for soundness and logic. It seems intuitive that stories are how we first make sense of the world. Think about a 4-year-old playing make-believe, the game that has no rules, no objectives, and continuously evolves as the child's imagination creates a never-ending story. As we grow up and learn more about rational paradigm, we're taught that stories have a beginning, a middle, and an end. This linear construct becomes ingrained in our beings and limits our understanding of reason and rationality by separating logic from everyday discourse. Consider academic journals. These ensure coherence by providing a standardized structure of background, methodology, research, and discussion. The narrative that I tell is different from yours because each person uses their own mental framework, knowledge, values, background, and experience in order to tell stories. These same factors influence how we hear stories, make sense of them, and use them for decision-making. The narrative paradigm helps explain what any word, phrase, or image can conjure up an enormous complex story behind it. Enema is a great example. In some cultures, enemas are used as part of healthy living, where others see it as an abnormal pre-surgery necessity. For any narrative to make sense to the audience, it needs to be coherent and have fidelity. Coherence means that we need to feel the story hangs together. It also has a lot to do with our own understandings of the law of the universe, the world, and how it works. For stories to be coherent, they also need to correspond to stories you've already heard. Fidelity relates to how much the story feels true to us. This does not mean judging whether a story is true or not, but that the story feels true to us given our existing value system. If it matches up, then you will be willing to use it as a guide to your own actions and decisions. But if it doesn't match your existing value system, then you are more likely to reject it, to consider it false and untrue. This often makes it difficult to learn from stories because we may reject those that don't correspond to ones we already know and feel. This is often the source of echo chambers. Think about conspiracy theories. For some people, there's a strong sense of fidelity to the narrative, while others dismiss it as paranoia. So what does this mean for public health? Traditionally, public health is anchored in evidence-based practices. It is logical and transactional and gives us a clear way to both make decisions and justify them. Fisher describes this rational paradigm as but one way to tell a story about how people reason together. As a profession, we believe it's our responsibility to ask, when do these linear transactional understandings perpetuate the same master narrative or dominant ideology over and over again? When do they reduce people to demographic characteristics? Public health discourse also instills in us what is normal, good behaviors. However, if your lived experience does not match up to these stories, you become what is not normal. There's nothing wrong with the stories, there's something wrong with you. Even in emerging, promising, evidence-based practices, it matters who gets cast in doing and receiving services, who has access and privilege, who is expected to change. Our presentation is about an alternate reality, an alternate paradigm, one where both transactional and relational discourse are viewed as a dance rather than in opposition. Before I hand over to my colleagues, I want to share with you how hard our team has worked on this presentation. Honestly, in my 20-odd years of being in this profession, this is the hardest I've seen a group of people work. This is because in determining what we were going to say, we continuously came back to the question about whose narrative we are telling and how do we make it hearable. While the storyteller can, to a large part, control the words or data that are used to tell the story, the teller cannot control how it is received or made sense of. So our intention for this presentation is to provide a mirror to our 7+ years of working together, to reflect on how we have made sense of narratives and what, in our experience, has influenced the telling of the story. Today, we hope to unpack both sides of the narrative, the teller and the receiver. Michelle Munsey will start by focusing on funding and how the decision on what to fund and how to define success influenced and in turn influences whose narrative emerges. Simon will talk about who gets to own the narrative, including any data collected. And finally, Sarah will pull all the characters and influences together and provide examples of the types of reflective questions we ask of ourselves.
Thanks, Michelle. So there's no doubt that funding is an important factor in the work that we all do in public health here in Maine. It helps us accomplish our programmatic goals, build relationships throughout the state and beyond, and maintain sustainable public health programs that support Mainers. Though no doubt important, funding can also significantly influence the way we do our work and the stories that we're able to tell as a result. Oftentimes, funding is very focused on a problem that needs to be addressed. It paints a picture that a certain community is struggling with a certain issue and somebody else needs to come in and fix it. Though this can be true in reality, it begins to define the narrative from the very beginning of a project or program. First, it implies that the issue of concern may be so significant that it warrants specific funding to address it. Again, this may be true. In reality, it may be supported by data and previous studies. However, it may also be the result of a political or biased narrative that can have negative consequences on the community. Second, this type of problem-focused funding structure implies that the solution of the individual or organization that receives the funding knows what's best for the community of focus. It makes an assumption that their solution, though it may be rooted in science and evidence-based practices, will solve a community's problems without always consulting them first or including them in the process. Where funding comes from can also bear weight on the narrative that's being portrayed and can set the tone from the onset of a project. As a hypothetical example, if I was working on a project focused on helping female prisoners with access to breast cancer screenings while they are incarcerated, my project may look very different with funding from the US Department of Justice compared with funding from the US Office on Women's Health. One funding source may require that the project takes more of a criminal justice approach, while the other may approach the work from more of a public health perspective. Both are valid frameworks, but both tell a very different narrative. Not only does the funding source influence the approach of the project, but it also may influence the data that's collected and reported back to the funder, which in turn can then influence the narrative that the funder is sharing. And sometimes this can have unintended negative consequences on the communities of focus. Along similar lines, because of funders and funding requirements and fiscal agents, more often than not, communities and community-based organizations don't always have the opportunity to really own the money that was awarded to them or the narrative that goes along with their project. They have to meet the requirements of their fiscal agents and their funders, and often end up jumping through hoops just to maintain the funding. All of that being said, there is a reality in the world of public health, which is that funding is completely necessary. And we often work with the funding that we have to have the best impacts that we can for the communities we serve. Sometimes this requires us to work around some of the challenges to be able to share the narrative from the perspective of our projects, but also from the perspective of the communities we work with. So here are a few reflections from projects that PFH in Maine have worked on to help keep the community at the center of the narrative. First is to try to be deliberate about funding. So when possible, identify not only the issues within your community, but also the solutions that will work best with the community to address those issues. With this in your back pocket, you can seek out the right funding that meets your requirements. This allows your project to implement more of a solutions-focused project that meets the needs of your community and also allows the community to have a stronger voice in the story that's told as a result. Next, try to seek general operating funds. Though it's not always possible, any opportunity to apply for and obtain funding through general operating funds can be a huge win for your narrative. This type of funding often allows projects to determine how best to use the funding and to address the needs of their community. Such grants usually come with fewer restrictions, fewer requirements, and oftentimes fewer preconceived notions of frameworks for addressing community issues. This also often means that the project is able to have more of its own voice and tell its own story. And number 3, strike a balance. We completely understand as public health professionals ourselves that the funding we have allows us to do our work, and we don't always have the luxury to wait around for the right funding or to pick and choose the opportunities that best meet our needs. But when possible, we try to strike a balance between the two. We can keep our traditional funding while also seeking alternative types of funding and funding sources that allow us more flexibility and more power to have a say in the narrative that's told. And with that, I'm going to pass it over to Simone.
Thank you, Michelle. I would like to add to that. Although funding can help actually create more room for alternative perspective, more must be done if public health is to actually place a higher priority on diversity, equity, and inclusion in order to co-create, I believe, collaboration. I believe that community members and public health professionals and researchers have to collaborate on an approach to public health that is more for the collective wisdom to include all lived experiences. And there is not while there is not a perfect answer, I believe that there is few findings that we would like to share with you that helps with our principles that have informed our approach. So principles can act as a compass when making a decision. It is also to keep projects and partners focused on what matters most to the communities at hand. The process of identifying principles, ensuring principles. However, in the years since the following principles were developed, we have found there are few helpful places to start and can be applied across projects regardless of resources, environment, and focus, and are as follows. Number 1, community self-determination. It is actually quite crucial for us that community members thrive to identify as an issue, but also to come up with a solution to it. It is also important to remember that team members and participants are from the community and also lived in the community. Their personal and professional works, it's always at stakes when trying to undertake these programs or undergo research. Most health-related topics can be viewed from multiple perspectives: clinical, public health, religious, social justice, and many more. For communities to own the narrative, the decisional perspective is their prerogative. 2 can be strength-based approach. Often we are so familiar with medical disease focus model that is imposed to constructed to communities, and in unintended consequences may at best be the creation of others, at worst, the pathologizing of an entire community. Either way, the imposition of this model evokes strong feelings among participants and threatens to erode trust, perpetuate stigma, and solidify a sense of powerless isolation. An alternate strength-based approach emphasizes our community resiliency and focuses on solutions that meets the needs of everyone involved. It defines the narrative as of shared well-being. Leveraging individual and community strengths allow for for a non-judgmental, non-sensationalized approach that is of the community, by the community, and for the community. Number 3 is mitigating power dynamics. Continuous reflection to power dynamics, structural inequalities, and historical harms are critical to respectful and equally engage. This deliberation influence who's invited to the table, what social norms will frame the conversation, and where the conversation are being held. That is more familiar and less foreign than professional or clinical venues. Each person knowledge the perspective is honored. This has helped to mitigate implicit bias guarded against gross generalization and stereotypes. Four would be inclusive decision making. As Haley have mentioned in her previous uh, presentation, cherry picking can occur and can be damaging for community of focus. So in our program, decisions are made together after careful, sometimes slow, really slow conversation. Evidence-based strengths are also balanced between community lived experiences. Sometimes the best action is inactivity, sometimes is avoidance, and sometimes is to stand firm and lead. Regardless, we slowly and deliberately make this decision together, and that's really important. That part, we make the decision together. Conversation that offers a window into the life of individuals, families, neighborhoods, and community arises as the result of efforts to uphold these principles. By bridging cultural gaps, these efforts, the storyteller and the audience tells a variety of narrative from from which we might learn. Community organization, in particularly ethnic community organizations, serve as a carrier and a social fabric, and are frequently the best places to offer a secure space, more respectful dialogue, and less inequality. And I would like to leave you with an African saying: when the elephant fights, is the grass that suffers. This serves to us as an example not to lose sight while we are doing this work. It also helps us not to not to let politics or our egos to stand in our way of our humanity. Thank you, Sarah.
Thanks, Simon. So to wrap things up, public health programs are often led by professionals who invite community members to inform project activities. At worst, this can be seen by community as leveraging community expertise and knowledge as free or unpaid consultants. At best, it can be seen as collaboration that can positively impact both the professional and the community. Regardless, the traditional professional participant relationship remains, where the professional is both the writer and the director, and the participant remains the actor. The unintended consequence is that the professional becomes the repository of knowledge, while the participants remain anonymous and detached from the innovative practices that emerge. In essence, the professional becomes the only storyteller. And while this may satisfy our need for rational narratives, it may also negate contributions to the field of that public health. It may also negate contributions the field of public health could make. Public health, as we know, has many cultural, gender, class, traditional layers, as well as social, economic, medical, and legal ramifications. Changes in community practices and health-seeking behaviors are less likely if programs are perceived by communities as criticizing or attacking local culture and values, or if they're driven by outsiders. Both locally and internationally, it's been recognized that successful public health programs address social norms, their attitudes, behaviors, yet there are few narratives in mainstream public health that demonstrate how this is achieved. Understanding that those closest to the problem are often closest to the solution, but furthest from the resources or power to enact change is a helpful place to start. Facts resonate with us when they're presented in stories that make sense to us. Rather than create rigidity, public health has the potential to bring together different perspectives and sectors to have safe, crucial conversations that enable strength-based solutions. But if we want to harness this potential, we need to embrace multiple stories, even those stories that may not appear coherent to us at first or fit within our own worldview. Narrative scholar Dr. Gretchen Bussel sums this up pretty nicely. We need more people to tell stories that do not correspond to the master narrative. We need more people to push back against the stories that only tell a partial truth. Whoever controls the narrative has the power. We together encourage you to claim your power. by deliberately asking yourself the following questions when you're conducting your evaluation or research. Who is framing this story? What are they selling me? What values? What beliefs? Am I reflectively accepting narratives that tell me what or how things should be done? And whose narrative is this? Thank you. And if there's any questions that anybody has, please ask away.
Thank you all so much. What a great presentation, so informative. For folks who are in the virtual room, please use the Q&A to enter in some questions. We do have a couple that have come across already. So in your work, how do you make sure the many diverse narratives are represented when there are so many? And how do you make sure a narrative isn't inadvertently excluded?
Who wants to take it?
I can start and maybe others can follow. I think public health has a unique perspective. What we've been able to do is show that we don't have an agenda. So because we've come to conversations without a strong viewpoint, we've been able to create containers where legislators and doctors, community members, imams, can all come together and have conversations. And I think by trying to make sure we can create an all-inclusive space and not imposing our own worldview is what we try and do. Yeah, I think that's, for me, it's creating the container that people feel safe in conversations. Michelle, you look like you have something to add.
I was just going to say, I think in large part, the answer to that question goes back to what Simone was saying about inclusivity, and like Michelle Mitchell was just saying, if we create that safe space where as many voices as possible can come and have a place to share their thoughts and to share their opinions and their perspective on the narrative, kind of collecting all of those voices and doing your best to be as inclusive as possible is probably the best way to make sure that all pieces of the narrative are included and nothing is missing.
There's also something to be said, in addition to what my teammates have said, to power dynamics. So when we brought people together, like Michelle Mitchell just mentioned, we introduced ourselves by name, and that's it. Because that's who you have to start the meetings where you're collecting the narratives, where you're having a conversation or getting people to feel comfortable in an all learn atmosphere, where it doesn't matter what title you entered the room with. You're here with no agenda. You're here to listen. And I noticed a change in the information that we pulled from people in these conversations. That sounds manipulative, but when we eliminated titles and just tried our best to get rid of the power dynamics that we anticipated just might naturally be in a focus group or in a large just community conversation. People let their guard down and become more human. And that is where you get really good data, stories, narratives that are a little bit more raw and inclusive. It allows people who otherwise wouldn't speak up because of those existing power dynamics to speak up and in a lot of cases run the conversation, which was exactly what we were hoping for.
And like, if I could add one more thing on what Sarah said, as someone that is as a team member and also is from the community, the importance, the number one priority is that actually the community, when they actually voice an issue, they're not really listened to. It's like they're listening, like certain providers, but it's also, like Sarah said, the power dynamics. Certain, like for example, a bigger agency will talk with like a one representative in contrast to a community, the majority. So if you listen to one person complaining in order, because he's still gonna voice his personal matters, but now he will summarize it. But when you bring all the community, say what's your issue and what's your issue, and we take the time to listen, then they take the time to trust you and actually open to you and say, this is what's going on with me, this is what I don't like. So that's really important.
Thank you all. And we have, we started a little late, so we'll take one more question with maybe a quick 30-second answer if it's possible. Have you found, sorry, my screen just jumped. Have you found that consensus-based decision principles are a useful approach for making decisions inclusive?
Yes.
Consensus, yeah. So that,
And I just would, sorry, you go, Sarah.
but just also that, yes, if you want to move forward, but also there can be two truths in a room. And that's something we forget, I think, that there can be sometimes you can't come to consensus. And what does that tell you? You know, that could be in and of itself a chapter in your in your paper. So don't get hung up on it because you might miss, you know, the multiple truths that are making themselves known because you finally made a space, or because a space finally became available. Go ahead, Michelle.
I have nothing to add.
Thank you. All right, so we are pushing up at time. We do have one request from the audience. I think your presentation is already up in your session, but they're interested in those questions that you asked at the end, Sarah. So if you want to send those to me, we can get them added so folks can go back to this session and see those there in the next, whenever that happens. So we will take again another quick 1-minute break, and then as we shift to our final presentation in this 90-minute block on youth informed messaging. So thank you all. We will be back hopefully around 11:25-ish. Thanks. and welcome back to the third session within this 90-minute time frame. I'm excited to be joined by Keeney Anna Tinkham, Executive Director of the Maine Resilience Building Network, Rebecca Jewett-Card, President of Public Health Partners, and Sheila Nelson, Health Program Manager with the Maine CDC. And we will hear from them on the development of youth-informed messages for adults to improve youth mattering in Maine. Thank you, and take it away, Keeney.
Thank you. Appreciate being here today, and to my colleagues who have joined us for this session. Today, we will be talking about the development of youth-informed messages for adults to improve youth mattering in Maine. I want to let you know that the presenters today do not have any personal or professional anything to disclose regarding commercial relationships. Funding for this project comes from the Association of State and Territorial Health Officials and the Center for Disease Control and Prevention. So I would like to ground you in the what mattering is in some of the data in Maine as we move forward to discuss messaging for adults. So mattering, as described and defined by Dr. Gordon Flett, a researcher in Toronto, Canada, he reminds us that mattering is a sense of being significant and valued by other people. So people who believe they matter to others have a key protective resource that can buffer them from life stressors and challenges throughout their lives. So again, mattering is a protective factor. And we have research available to us from the Maine Integrated Youth Health Survey, 2019 and 2021 data, along with US CDC data regarding social connectedness and mattering. Here you'll see that high school students report they feel they matter in their community, along with data here in Maine. So in 2021, we're looking at data from the Maine Integrated Health Youth Survey that reports that 51.5% of Maine high school students feel that they matter in their community. And this is a decrease from 2019. We also know in Maine from this data set that there are marginalized groups of young people who identify as female, LGBT, and multiracial students who significantly report likely to feel that they matter in their community. Examples, 35% of youth who reported being gay and lesbian youth report feeling like they matter in their community as compared to those at 51.5%. And again, bisexual youth, as reported by young people, 35.6% report they feel like they matter in their community. Thank you, Sheila. So mattering and social connectedness is strongly connected, and social connectedness is one of the 5 priority social determinants of health to focus on, and all of us can relate to the impact of social connectedness and lack of during the pandemic as an example. Again, we have data from the US CDC that specifically speaks to successes of youth as reported when they are connected regarding behaviors at school, grades, etc. So mattering and social connectedness are strongly related, both important protective factors. So the need for adults to change their behaviors towards youth are clear. Opportunities exist for adults to change their behaviors to help young people feel supported and that they matter in their communities. So in both individual and collective adult behaviors won't be modified without a shared understanding of the specific changes that are needed and clear communication about those changes. So we're here today to talk to you about adult behavior changes that young people report to us and the individual and collective impact when adult behaviors are modified. Next.
All right, so this work that we did was part of a project funded by the Association of State and Territorial Health Officials, ASTO, over a 2-year period. And it was called the SOPI Project, Suicide and Overdose Public Health Initiative. And the aim for this project was to build state level infrastructure to address the co-occurring issues of suicide and overdose death in the state of Maine. And within the state, we took a real primary prevention approach to these issues. And, you know, it's like we like to describe it in public health, tried to look really upstream when we thought about suicide and overdose prevention. So we saw this as an opportunity to support the increased awareness of youth mattering as an issue that was important both to Merben and to Maine CDC. And one of the key things that we did right off the bat was to contract with 5 community partners to help provide input and the voice of young people across the state, and particularly some of the most vulnerable young people in the state of Maine. So you can see the list of community partners who worked with us on this project here. Okay, Sheila. So here's the process that we use to develop a communication plan around the issue of youth mattering. We engaged a public health communications consultant to guide us through this process. And we really started with an open approach. We didn't even know who we were going to direct messaging to. We started with that. So let's just go right into the next slide. For our audience identification phase, we used a couple of different strategies. First, we used a data and document review. Merben had recently completed roundtables with thought leaders and also community meetings on the issue of youth mattering. So we started with a review of those meeting summaries to see what were the key themes that were emerging there. And we also made sure we had access to the most recent Maine CDC Maine Integrated Youth Health Survey data on mattering. And then we had a series of discussions with staff members from Merben, Maine CDC, and PHP. And we discussed both the current efforts around mattering in the state to understand how any messaging that we developed would fit within those existing efforts. And we also, considered who needed to hear what in order for change to occur. And ultimately, we agreed that there were many audiences that could benefit from messaging about youth mattering, but we selected business and community leaders for this specific messaging effort. During our formative research phase, we conducted discussions with key stakeholders. So this was namely youth and business and community leaders. We conducted a focus group with adults and asked them about their perspectives on youth mattering, what they currently do to show youth that they matter, and what changes they think that adults need to make to ensure that youth actually feel like they matter. And most importantly, we worked with the community partners to gather input from young people. And we did this in a variety of ways. We really wanted the community partners to have the flexibility to engage with young people in their programming in a way that made sense for them. So we gathered this input from young people through a combination of surveys, through one-on-one discussions, and a focus group. And we paid the young people for their participation. After analyzing the input that we gathered, we worked with an advertising agency to develop some draft concepts. And then we went back to our stakeholders for feedback. So we hosted a focus group with adult and community leaders and staff from Merben, Maine CDC, and PHP. And we also asked the community partners to gather feedback from their youth participants. And with that, I'm going to hand it over to Sheila to discuss what we heard and what we did with that information.
So during that formative phase that Rebecca was talking about there, we sort of gathered a set of concepts both from the sort of adult community leaders that we had been talking to and the young people that we had engaged across all of those different organizations. And these were some of the sort of, key pieces of that content that emerged for us. I don't think they'll be super shocking to most of you, but it was still really important for us to be grounding ourselves in the actual experiences of young people and adults in community rather than, making assumptions about what we thought the needs were for any of those groups. So from adults, we heard a lot of really genuine and heartfelt desire to engage with young people in their communities. They felt like it was really important. The young people felt like they mattered and felt like they had connections, but they often really struggled with how to make that happen. Like, what did that actually look like? Moving from sort of a big picture concept to a, what does this become in action in our organization or in our community? They were also, really bringing up a lot of the realities of smaller communities in Maine, rural communities in Maine, smaller organizations that serve young people, which is that, resources for young people in terms of sort of the infrastructure that, might help support young people feeling like they matter is lacking or difficult to come by in some of those communities. And so, they were really interested in how they could apply some of these concepts in different settings and across different, parts of the state that may or may not have the depth of resources and programming available to young people directly. From young people, we heard a similar really, genuine and heartfelt desire to engage with their communities, to be part of making positive change in the places that they live, learn, work, and play. And also that they often felt like, the adults around them dismissed that, that heartfelt desire to be participating, that they felt like they had ideas, they had thoughts about what kind of changes they wanted to make, but that those thoughts and ideas were often either unheard because there were few opportunities for them to share that content with adults in their lives. And if they did, that they often felt like their concerns were sort of dismissed or deprioritized, in settings that were largely overseen by adults. They also want adults to meet them halfway, that they want to be participating, but that they also need adults to be making meaningful changes in the settings where we work, learn, live, and play, to provide space for young people to take an active leadership role and to bring forward what they feel like is really important to them in their communities, rather than making an assumption about what we think youth want. So as we sort of, took that, kind of input from that formative phase and moved towards really trying to kind of figure out what we wanted to be, sort of offering to the community as messages that would support meaningful change to improve the lives of young people, this is sort of where we ended up. And again, I want to sort of reinforce what Rebecca and Kini both said, is that although we're talking a lot about young people here and the importance of young people feeling like they matter to their community on their overall health and well-being, these are messages aimed at behavior for adults, right? Because in many ways, it's on us as adults to be demonstrating to young people that they are valued in their community and that there are connections available to them, and that we want them to be actively participating in moving our collective well-being forward. And these are the three sort of major themes that we kind of came to that resonated for both young people and adults. The first is, this sort of check-in for a change, which is really, again, was a little bit focused on the idea that small actions can make a big difference, right? That if you are a business leader and a young person walks into your business or your store, taking an extra effort to be welcoming to them, to say hi, to, sort of take those moments and pause and really engage with young people in ways that make them feel seen The second is really, again, sort of building off of that to really carve out room in sort of the adult world of community change to really hear from young people in a non-tokenizing way about what is important to them. And that if we are willing to hear that input, to then actively, as adults, be willing to be partnering with young people to bring that change forward, rather than assuming that adults are going to always be the ones to lead that change. And the third one is, sort of, again, building on the other two, is to take a really extra effort to step back again from the world that adults experience every day. Many of us were young people somewhat long ago. I'm just going to leave it at that. It's been a bit, right, since many of us were teenagers. And young people are in a very different world than certainly the world that I grew up in. And so it is imperative on adults to recognize that although our experiences are very valid, they're not necessarily the experiences of young people in our communities today. So what do we do with all of this? You'll sort of see that you saw some of those messages were kind of more like a framework than a very specific piece of content. And that was because we wanted to leave them sort of open enough for organizations and communities to really tailor them in a way that reflects what's happening, with adults and young people where they are, and according to their mission. So we are really hoping that these sort of messages will kind of become part of the public domain, that by having done the heavy lifting of reaching out to young people and adults and working through that whole process that Rebecca talked about, that takes a little bit of that burden off many smaller communities and organizations who may be challenged to do that themselves, but that these messages that we found that resonate with adults and young people are still available to you to use in your communities and organizations to adapt and promote them, again, in your setting in the way that you feel like is the most appropriate for your work. And I'll pass it back to Kini just again to provide a little bit of an example of sort of how Mervyn took some of this content and translated it into some, potential action steps for supporting the well-being of young people through, again, changing the behavior of adults.
Thank you, Shayla. One example is we developed in collaboration with this group here today, a community guide, which is available to community members, organizations, Maine Youth Thriving, a guide for community action. And through this tool, we work through some of the messages and listening and learning from the young people in the organizations that we worked with on what mattering meant for them. And we brought in additional resources and evidence-based strategies into this guide. An example, we'll be adding these guidelines that will be another tool available to organizations and communities to really shift the culture, to do the work, come in at it as a couple of community caring members. Maybe it's an organization. The goal is cross-sector, and certainly youth at the table is part of the decision making. So we can't underscore that enough, to be inclusive of youth, a diverse group of youth who live in your community, that gather with you to lean in and listen and learn, and consider developing a vision and moving forward in a thoughtful way, that we really do help youth feel like they matter, they're socially connected to their communities, they add value to their community through the workforce, in the thriving community and game. So that's one example.
Yeah, and I think our goal is to, really have some of these concepts kind of form, again, a foundation so that we can use them as touch points when we're having conversations with adults in adult spaces about how to engage with young people, and also as a reminder to us of how we honor and validate youth voice when we are inviting or engaging with young people in their settings and around their priorities as well.
So this project was a collaborative And it couldn't have been accomplished without all of the organizations on this slide. So we just wanted to pause and, thank all of these folks for helping to support this effort in a variety of ways.
Thank you all so much for this fabulous presentation. Definitely a lot of good information and learning for folks. We have some questions that have come in, but a reminder, just use the Q&A function to ask a question. We'll try to get to as many as we can. So the first one, and I think this is a problem that occurs in the adult population too, is that you might have young people who are more likely to step up and be involved, and so they have the louder voice. So do you have suggestions on how to engage young people who might not normally be likely to step up, those young voices that might not otherwise be heard?
I can take that. I would suggest creating safe spaces, welcoming spaces for youth. So within the culture of the community, so they want to engage and step up and be part of decision making. So it might be considering your signage. What are some barriers in community where youth feel like they're not welcome or that their voice doesn't matter? Businesses may lean in and think about how they greet young people when they come through the door. What is the signage, and are they welcome to hang and chat with their peers for a little bit, their colleagues? I think libraries are a good example of how they've made this shift and created spaces for young people to feel safe, and giving them power to make some decisions and advise libraries on what is considered safe space for them. So I think when we set examples and we start making small acts, but bigger, deeper policy shifts, that's going to help welcome youth across all populations to come to the table. And again, it's core to it is relationship building and engagement where youth feel safe and welcomed.
And I'll just add to that slightly, if you have the capacity to do so, I think being thoughtful about what communities of young people are, maybe to your point, not the ones who are always, have the resources to step forward into adult space, and for, again, to put the onus on us to potentially be engaging with young people where they're at. And we tried to model that through this project, where we did not ask young people to come and sit down with us in a room, and we paid them for their time as experts in their own experiences. And so, that still can be challenging for youth who are not engaged in any kind of, coordinated connection. And that's a whole other presentation that someday we'd love to do, I think, probably. But where you can, to make it possible for them to be where they are rather than asking to come where we are.
Great, thank you. And we have one other question that's a little bit directed towards me, but I think maybe Kini, you can answer it as well. And they're asking whether NPHA has a youth counselor, other meaningful way to frequently hear from young people. So our membership typically in the populations we target typically start with college level. So we don't have a youth counselor, and we haven't had too many interactions with young people, but we are trying to engage more at the undergrad and graduate level to get those voices heard and integrate them better into the public health workforce as they move into their education and careers. But I'm curious for our speakers, if you all incorporate youth councils into your work and what that might look like.
At the Maine Resilience Building Network, we do not have a youth council. We intentionally, during this 2-year project, worked with our group of youth serving organizations. Moving forward, may we consider a council? I think yes. I think being authentic and being respectful of their time, and also recognizing our network that the Maine Resilience Building Network works with, many of whom have advisory boards. So it's not another advisory board that makes the difference, right? It's just how we're engaging and being authentic in the reach, both urban and rural. So again, how can we listen and learn from the existing youth advisory boards? I can call out Maine as an example, Teens to Trails. There are a number of organizations that have really shifted how they're doing their work as a result of the data from the Maine Integrated Youth Health Survey. So youth are feeling engaged and validated, and the relationships are authentic.
Yeah, and I'll just say again, Maine CDC continues to really prioritize supporting positive youth development and youth engagement at the community level across the state. And, you know, trying to, again, remind the public health field that that it's, you know, the wonderful thing about youth engagement and youth leadership development is in many ways the process is also the outcome. Not only are young people making really dramatic change in their communities, but the process of making that change for young people is then building, you know, a cadre of, you know, really talented, motivated young people who are going to step up and become our next round of thought leaders, if they're not already, and many of them already are.
Yeah, and just to build on that, just to acknowledge that really the work is to be done at the community. So we really need community-driven solutions. And again, building on what Sheila said, youth need to be at the table for that to happen. And it's the future of our community and the future of our state, that we have youth engaged and making a difference in our lives and their voices heard.
Thank you. And I think those points are ones that we should definitely end on because they are hopeful and uplifting as we go into our lunch break. So I want to thank the three of you for being here with us and our other presenters from this session. Reminder to please complete an evaluation. There are 3 different evaluations for each of these sessions that have been put into the chat and are available on the conference website within the session description. And you should also be receiving a pop-up that will have all of those links as well. So we will take a, I can't do math right now, 35-minute break, and we will come back at 12:30 for our first plenary panel of the conference on defining, assessing, and addressing virality in public health. So thank you, everyone. Enjoy your lunch, and hopefully you can get outside and move around.